mynews.studio.
Maternal deaths have nearly halved around the world. What shifted things so dramatically? And could that progress actually be at risk?
Today is November 29th, 2025. Since the year 2000, global maternal mortality rates have fallen by 41%. That's millions of mothers who are alive today. But what actually made this possible?
Three main factors come up in the data: better access to maternity care, more contraceptives available, and targeted investments in reproductive health and medical training. Let's start with access. Countries really focused on getting skilled birth attendants to women, even in remote or underserved places.
Which regions took the lead on this? Sub-Saharan Africa, Central and Southern Asia, and Australia and New Zealand all saw notable progress. What's striking is how different these contexts are, but each worked on strengthening health systems and making sure essential medicines were available.
Take Australia and New Zealand. They started with lower maternal mortality, but targeted campaigns still made a difference. Now, in Sub-Saharan Africa and South Asia, the challenge was bigger. There, it meant training midwives, building clinics, and making hard choices with limited resources. But focusing on maternal health really paid off.
Were the policies the same everywhere, or did countries have to customize their approaches?
They had to adapt. In some places, community health workers were crucial, especially where hospitals weren't close by. Other countries used government subsidies to lower the cost of prenatal visits. So it's not just about funding. Policy design mattered a lot.
But even with this progress, there have been setbacks, right? The pandemic disrupted maternal health services almost everywhere. In fact, some regions actually saw a rise in maternal deaths during COVID-19. Does that mean these gains are on shaky ground?
Yes, that risk is real. Health systems can only take so much strain. When funding or infrastructure is stretched, maternal care is often one of the first areas to feel it. That's why keeping up investment in midwifery, stronger health systems, and even just basic supplies is so important.
And funding is a big part of this. We're seeing aid cuts in some countries. If the money stops, do you think the downward trend in mortality can hold?
That's the worry. The World Health Organization and UN agencies are already saying that recent aid reductions could undo a lot of progress. So, governments and donors really need to see maternal health as a long-term investment, not just a short-term goal.
There's another layer too: underlying health issues. Conditions like hypertension, malnutrition, and infectious diseases are still major threats, especially in places facing humanitarian crises.
Exactly, and the risks are even greater in conflict zones. It's not just clinics or medication. It's about addressing root problems, from nutrition to social conditions. That's why maternal mortality tells us a lot about the overall quality of a health system, and about gender equity too.
Why does this matter on a global scale? Is it just about the numbers, or is there something more we're missing?
It's proof that change is possible. When countries coordinate and invest in the right places, even major challenges can be tackled. It's a model for other public health efforts.
So if maternal deaths can be reduced by 41% in under 25 years, what else could be possible with real global commitment?
That's really the big idea. This is about more than just survival. It's about building stronger, fairer health systems for everyone.
We've looked at the numbers, the strategies, the obstacles, and why it all matters. The main takeaway: progress is happening, but it can be fragile.
And this isn't the end of the story. Maternal health reflects so much: how health systems work, how societies value equity, how progress is measured.
Thanks for joining us as we unpack the global decline in maternal mortality.
We appreciate you listening. This episode was brought to you by My News Studio. Try it for free.